What's up, everybody? You are listening to the Strength and Knowledge Podcast. This is Dr. Zach Baker, and I have with me today special guest, Dr. Corrie Jones, Director of Clinical Excellence and Physical Therapist at Rehab to Perform, where she operates out of our Frederick location and carries a variety of roles. She helps out with our sports residency. She leads our mentorship initiatives. She's involved in patient care, both at Frederick and also at Hood College, one of the local Division III athletic programs close to our Frederick location. And something that is not a foreign concept to Corrie is continuing education. She has probably taken more continuing education than most of the people I know in the profession. And it's something that I think it can be done very, very well. And I also think a lot of people waste time, quite frankly, in the Con Ed space. Because they just don't have a game plan, or they're not strategic with how they're going into these courses, and they leave one of two things: either very overwhelmed because they're so excited about all this new information that they got, but they have no clue how to use it or retain it, or two, they're underwhelmed. And they go to it and they're like, oh, that was a terrible course. I already knew everything. The speaker wasn't that good. And they were expecting to get like the doors blown off of them with this great course, and they're like, it was kind of so-so. So, Corrie, if you had to give tips, and whether this is a new grad or somebody who's been in the space for a while, but what would be 3 things that you would keep in mind when you're either picking out a course or attending a CEU course?
Yeah, this is a topic I would say we get asked by our students a lot, and new grads, and honestly anybody. You and I were talking recently. I would say there's 3 main things that I would kind of say that you're using to decide if you want to take a CEU course or not, and how to kind of pursue that. One thing is if you're looking to really dive into a new topic. So, hey, I want a new tool in my toolbox, or there is a new diagnosis that I really want to dive into. That could be one. I would say another reason to do a CEU is if you have a certain perspective on something, but you want to reframe it. Maybe you want to see it from somebody else's perspective. Maybe you want to see it in a different light. That could be a great thing to do with CEUs if something's getting a little stagnant and you want to see it in a new way. And then the third thing I would say is networking. You're seeing other PTs there, and you can really get interested in some niche stuff. So a great opportunity for networking is hitting the right CEUs.
I love that list. And when we go back to the first one, you talked about going to a course because it's new or it's novel material. Kind of 2 questions with this. Is there a certain type of clinician that you think this is better for, meaning like a newer versus an older clinician? Or is there ways that somebody can best prepare for this course? You know, they're really excited about going to a course for a weekend. It's a topic that they've heard a lot about, but they don't have much experience with. What would be your recommendations to really fulfill that first bucket?
Yeah, I would say definitely it would be for anybody, because if you want a new tool, gosh, you could be young, new grad. Hey, I've heard about this in school, but I want to dive a little deeper and be more confident in it. It's a great confidence builder, which is a huge thing when you're a new grad. Or you could be a therapist that's been practicing for a long time, and you're like, man, I have new interests. I feel like I've seen kind of some of the same things over and over, and I'm going to dive into something new. Like for me recently, that was concussions. I didn't have a ton of experience, but over the last 3 years, I've learned a lot more about concussions and feel really comfortable with them now. So no matter how far out you are, diving into something new is always helpful, because guess what? You can help more people that way. So that's huge. Or you have a different new tool to treat the people that you are already seeing in a new way, or in a different way that might be more effective or more helpful. I would say to prepare for something like that, best thing you can do is come with an open mind, but then also kind of like ask yourself a couple of questions to discern where your gaps are. So if I'm going to CEU course, I don't want to just sit there and absorb without any intentionality. I want to know, I have these 5 big questions about this new topic. So these are the things that I'm hoping to leave with. Number 1, that'll help you pick up what you're looking to lay down. But number 2, it'll help you with questions. Every time you go to CEUs, people are presenting information, and they always say, hey, any more questions? If you don't have anything, that's fine. But it's really, really helpful if you can define for yourself, these are the things I want to clarify in picking up this new tool.
Now, shifting to the second topic that you had mentioned, how can somebody get the most out of a CEU course if it's something they're already familiar with. And with this, I'm going to be going to CSM next month. And when I look at the lineup of speakers, there's not going to be many topics on there that are things that I haven't been exposed to or am unfamiliar with. So there's probably going to be a good overlap of information, and it'll be quality information, but there will be some overlap. And instead of 20% of it being known and 80% of it being new, it's probably going to be the opposite. 80% of the information I'm going to be familiar with and 20% will be new. How can somebody in that scenario get the most out of it?
Yeah, I would say that's the situation I've been in the last couple of years. Once you've been in therapy for a while, I mean, we've been in it, you and I, over a decade. A lot of things start sounding similar, and a lot of people are really good at reframing things. But my best advice would be to pick up at least one new thing, one or two new things. Sometimes I'll go to an entire course and I'm kind of like, yep, heard that. But I can go home with one or two new ways of doing things or one or two new ways of thinking of things. So the biggest thing is to again, have a little humility. Don't go in with arrogance saying, I know all this, but go in instead with an idea of growth and say, maybe there's a couple of different ways that I can use this information, reframe it, see it from a different perspective so that I can be a better therapist. Whenever I come with that attitude, I feel like I always leave with at least a couple things that I can start implementing and be better with whenever I go home from a CEU like that.
That's great. And a lot of times I'll go to that course and I'll see somebody demonstrate a test or a skill or an intervention that looks like something that I do regularly, but I realize, their hand placement's different. Their body language is different. How they communicated what they were doing or the intention of it was different. So it's those little nuances that give you a little bit more of like the art of patient care as opposed to maybe necessarily the science of it and the delivery. Now, last thing, we're going to a course. We know we like the material or we know we like the speaker, but even better, there's going to be a big group of people there. And we may meet some people that we haven't met before. How have you in the past made the most of your CEU experience from a networking standpoint or just enjoying your time while you're at the course? Because it could be 1 or 2 full days that you're there.
Yeah, so this kind of comes down to, just social intelligence, having a good time, making sure that you're seeing this as an opportunity for networking and not just the clinical side of things. The good thing is most physical therapy courses, if there's any kind of practicality to them, you're paired up with someone. So being able to pair up with somebody, get to know them, talk to them a little bit. Hey, where do you come from? Basically getting a little bit of clinical decision-making from that person or clinical experience, get their little anecdotal kind of things. Like you said, how do you communicate this or how do you get after this? So helpful because then they remember you as a person who wants to be better at PT and wants to connect. So it's kind of nice because let's say you have a little break, you get to chatting with some other people. Hey, they bring up something else that you're interested in, or they tell you what CEUs that have been helpful for them, or they tell you of opportunities to share what you know. Networking at these places is so helpful because if you come to it with a mindset of opportunity, every person you meet, number one, it's fun because I love getting to know people, but number two, it can be an opportunity for something else to do, something else to get involved in, another way of perfecting your craft. The only way that knowledge is shared is when you meet other people. So guess what? If you're networking with people that are interested in the things you are, you can niche down a little bit more, or the exact opposite. If this is a new thing, it's going to open your world to a new avenue. So spending time getting to know those people, then you can follow up with them later with more conversation or emails or whatever to become a better therapist because you're gaining more knowledge from who they're with. But then it's also just having fun too. Hey, these are people that are also PTs, like-minded. Lets you have a little bit of a good time at these CEUs as well.
It's funny. I can't tell you how many times I've been at a course and I find somebody that's a really good connection. Hey, they have access to a group of people I've been trying to get in touch with, and I just haven't found some sort of mutual connection there. Or somebody who has had experiences that I've been seeking out in my career, and I haven't had the opportunity to talk to somebody with that. And I find it out like as we're leaving on day 2 of the conference. It's like, oh, well, that was a wasted opportunity. I could have found them earlier. So that's where I'm like, when you get there, introduce yourself to somebody, whoever you're sitting next to, talk to them, introduce yourself during breaks, water breaks, just make it a point to try to meet somebody new at every time you have a break with that. Anything you would add to that, Corrie?
I would say that's actually been my experience for one of my recent things. So somebody had on a shirt. I was at a CEU. Somebody had on a shirt. It was a group that I wanted to work with. I was like, oh, that'd be so fun to work with that group. How'd you get involved with them? Whatever. He told me, gave me a contact, set up some stuff that now I contract yearly with US Ski because of what happened at that CEU. So those kind of experiences, it can even come from something as small as a logo on a shirt. And you're like, that is something I would love to do. So yeah, it's like a big thing. Just take the time to talk to people, and you never know how they got involved. And then knowing that person is what opens up doors for you in the future. That's huge.
Awesome. Well, Corrie, appreciate the perspective. If you are listening to this episode and you enjoyed this episode, please share, like, and subscribe. You are listening to the Strength and Knowledge Podcast. This is Dr. Zach Baker, Dr. Corrie Jones. Thanks for listening.